Welcome back. Right now, talking with Rosalie Yars-Meyer, the walk chair of the Purple Stride Walk. Thanks so much for coming in.
Oh, thank you for having me.
And
This is your first time being on the news, right?
It is, yes.
Awesome.
Well, actually, no, but
Yeah.
in a different situation.
For sure.
Completely.
Well, thank you so much for making the time and coming in today.
Thank
I
you.
didn't mean to wear purple.
But it's
kind of
so
on purpose.
fitting.
It's fitting for this.
Wonderful.
It is.
Thank you.
Because if you don't know anything about the Purple Stride Walk, this is really awareness and a fundraiser for the Pancreatic Cancer Network, correct?
That's right. So we're a nonprofit. It's a national nonprofit, actually, and we're all having the walk on the same day, which is April 25th, and ours will be here in Columbus, Dublin Kaufman Park.
Oh, okay.
April
So
25th.
you have, a really personal story to this. Why is this walk so important to you?
My dad had pancreatic cancer, and he was diagnosed 3 months before his death, and that was in 2010. But thank you.
Okay.
My diagnosis came unexpectedly as an incidental finding while I was trying to do IVF treatments.
Oh, wow.
I thought I had a different situation going on. I got really sick, started getting sick at work, so ended up in the ED, and they diagnosed me with pancreatic cancer.
When you got that news, what went through your head?
I was in a better mind frame because my dad had been through it, but my dad did not have the resources that we have available through PanCan. And that's one of the major reasons while I was getting my treatment, my chemotherapy, and my surgery, I wanted to give back and find a way to honor him. So I would love to have people connected with PanCan and find resources.
And PanCan offers some amazing resources.
They do, absolutely.
For folks who, are finding themselves in that situation or really just trying to learn about what some of the situations are once you get the diagnoses.
Right. And the major thing about pancreatic cancer is the majority of people who are diagnosed with it, they're diagnosed when they're in stage 4. So it's almost too late to receive any treatment. So we would like for people to become self-advocates and, speak to your doctor as soon as you find symptoms or signs that are not normal. And that way you can research treatment plans and get in contact with somebody with healthcare professionals.
I had a family friend pass away from pancreatic cancer, and it was stage 4, only a month left to live.
Yes.
It happened so fast. What are the early detections out there for people? For like colon cancer, you can go get a colonoscopy, but what is there available for pancreatic cancer?
Right. So there is a cancer antigen, and most doctors don't screen for it because it is so unusual. So it's called the CA19-9, and that is specific to pancreatic cancer. So you'd have to ask if you have a family history, especially.
Okay.
That would be a good thing to do.
Yeah, and let's talk about the walk now, is that, this is a huge fundraiser because just for the local chapter, we've raised almost $185,000 with a $265,000 goal,
Yes.
so 70%, which is amazing. This is going to be at Kaufman Park. So, and that's it's this Saturday, right?
No, the
it's the
following
25th.
Saturday, the 25th. That's right.
Okay. So, where can people go to sign up? How do we get involved?
You can Google us at pancan.org, and you can go on the website. And we have different teams, and we have captains that are involved. And so you can sign up on a specific team, or you can make up your own team, or just come and join us. We're very happy to have everybody participate.
Yeah, and this
Great.
is, this walk is more than just providing support for those who have it or have the history. It's also creating hope as well.
Absolutely.
I think you're an example of hope.
Oh, thank you. Yeah.
How are you
I
doing?
hope so. I am doing well. I'm in remission right now. So
Okay,
it's 2 years since
congratulations.
the diagnosis, and I have had tremendous support from healthcare workers because I, work for Ohio Health also. So, yeah, I'm doing well.
Good.
Thank you.
Good.
And, is this what keeps you, your personal experience is why, I assume this is why this is so important to you, and advocating for others to say, hey, make sure you're aware that you get some of these testings done. Is there, obviously we know that with certain cancers, it comes hereditary, it runs in the family. Is that a similar thing with pancreatic cancer? Do you know?
It is, but supposedly mine was not connected to my dad's, which is a little strange. But I feel like it was connected to a certain medication. So I saw the signs and symptoms, but most likely you have a family member in the past that may have, sometimes undiagnosed diabetes would be related to the cancer also.
Okay.
So yes.
Wow. It's such a horrible cancer that can take people's lives so quickly. So it's amazing to see you sitting here today and offering that hope for others. So.
Absolutely.
Is there anything else you'd like to say about the walk coming up, or anything you want people to know about?
No, I would just like to raise awareness for research, especially. That's where the funds are going, and free resources for the patients. So we would love for you to come down to the park and join us. And yeah, Angela Ann will be there. She's the MC.
She's over there dancing. Come on in here, Angela, quickly.
I wanted to do this like Vanna White walking behind you guys. Just like, here we go.
There we go. There's the information. And then I want to pull this up really quick. Here's a picture of you and your dad. Can you?
You're so sweet.
How old was he in that?
I am not sure, but he passed away when he was 69.
Okay.
And then I got diagnosed when I was 49.
Okay.
So a big age gap there too.
Wow. All right. Well, thank you so much for coming on
Oh,
today.
thank you. I appreciate it. Thank you.
Absolutely. Thank you,
Thank you
Angela.
guys. I'm
All
glad I
right.
can be a pop.